Good day everyone, my name is Nicole Kate Sirabanal from Bitled 2A, and now I'm going to share to you my reflection about the 14 categories of student with disabilities. The person is intellectual disability. The person has certain limitation in intellectual function like communicating, taking care of him or herself, and has impaired social skills. People with intellectual disabilities can and do learn new skills, but they learn them more slowly. Teachers must be patient, kind, and understanding. It is important to know that despite difficulties in a learning environment, students with intellectual disability can and do have the capacity to acquire. It may be helpful for a student if the teacher use a variety of teaching methods so that the students are not constrained by needing to acquire information by reading only. Use as many verbal descriptions as possible to supplement material presented on Blackboard. Deaf-blindness. It is a loss of both hearing and vision. Be patient and respect them, and a willingness to find a way to communicate to them even if they have disabilities. Let's treat them as a person with complete physical appearance. A specific learning disability. The imperfect ability to think, speak, read, write, and do math. Students need the proper care of teacher. Be patient and understandable to the student of situation of students. Deafness, hearing loss, always try to communicate to them. They need proper care and attention. Development delay. This is the child who has not gained the developmental skills that they expect. The teacher should help the children to make progress. Teach them how to read, write, maybe getting dressed or washing their hands, and many more that will help them to have a progress. Other health impairment. Having limited strength, they cannot do some things they want, vitality or alertness due to acute health problems. Emotional disturb. This happen most of the students. They cannot focus on their studies. They has anxiety disorder, bipolar disorder, eating disorder. Children with an emotional disturbance need to include attention to providing emotional and behavioral support, as well as helping them to master academics, develop social skills, and increase self-awareness, self-control, and self-esteem. It's speech language impairment. This is a communication disorder. I think they are afraid in communicating and participating in class. The teacher should encourage the students to face their fear. Traumatic brain injury, a sudden injury that causes damage to the brain. Students with traumatic brain injuries often need extra time to process information and complete tasks, as well as to respond to verbal cues and instructor questions. Encourage the use of schedules, checklists, and notebook to assist in organizing daily information. Orthopedic impairment. Disability that is related to the bone, joint, or muscle. Some strategies to help students with orthopedic impairment give spatial settings, arrangement to develop useful posture and movements for the students, awareness of medical condition and its effect on the students. Visual impairment. Loss of visual acuity and inability of the person to see objects as clearly as a healthy person. Imagine for a minute what life would be like if your vision was permanently impaired and could not be corrected with eyeglasses, contact lenses, or vision surgery. This is the situation many people find themselves in every day, suffering for what's called low vision. Multiple disabilities. The student has more than disabilities. Imagine one disability is hard. What more disabilities? Students with multiple disabilities often need support in every aspect of their life, both in the classroom and beyond. Hearing impairment. With hearing loss, it can be very difficult. It's hard to hear or understand sound. Teacher may help them the best they can. Talk to them. I know it is hard, but always try to communicate to them and always feel that they belong in a group. Be understanding. And last, autism. It is a complicated condition that includes problems with communication and behavior. The teacher must have these strategies in the classroom. Create a classroom routine, use preparatory commands and commands of execution to cue transition, give fewer choices, use appropriate technology, and treat them like any other kids as much as possible. Think how blessed we are that we live Every day in a normal life, we can see each other, we can speak, we can hear them, we can act, and we can do what we want. Let's close our eyes for a minute. Let's put our feet in their situation. Think what they feel in having that disabilities. It's very hard for a person to have that kind of disabilities. So let's be patient, be kind, be understandable to them. They are still people with heart. They always do their best to live every day to their fullest. Yet, that is not still enough for others. They need proper care, attention, and mostly love to the people around them. Help them if they need our help. Let's treat others the way we want to be treated and love each other.